I am so excited to introduce Dr. Aleksandra Gajer. She is a board certified physician specializing in women's metabolic health and hormone optimization. She combines rigorous medical training with functional medicine expertise, and she's helped thousands of women transform their health through personalized, evidence based approaches. Dr. Gajer is known for making complex hormonal concepts accessible and providing practical strategies that work with, not against, a women's unique biochemistry. Her mission is to empower women with knowledge they can use immediately to optimize their health at every life stage. So, Gaia, thanks for joining us. Take it away.
Thank you so much. Hi, everyone. All right. Today we're going to talk a little bit about metabolism and hormones for women, which is a topic near and dear to my heart. To start, I want to tell you a little bit about myself. I am a conventionally trained MD. I went to medical school at University of Maryland and then did a residency in emergency medicine. And while I really enjoyed emergency medicine, I liked the acute care, I liked the speed, I found that the people who were not coming in for accidents were coming in for the same thing sort of over and over again. And most of them were not getting better. And we could kind of put band-aids on different conditions, but in the long run, people didn't really get better. And I also experienced a level of burnout during COVID that a lot of other people were feeling. And I heard a lot of people complaining about just not feeling good. We could say, you're healthy, your labs look great, but people were coming in and saying, I just don't feel good. I don't feel right. Um, and it really inspired me to take my career in a different direction and work with both women and men, but primarily women on metabolic and hormone health, which I think are at the root of longevity as well as our overall well-being. So metabolic health is one of those words that is a little vague, but your metabolic health or metabolism is basically what happens to food when you put it in your mouth. People with good metabolic health will turn that food into energy and fuel their body and use all the nutrients. And people whose metabolic health is poor will store more of that as fat. You won't be able to burn it as energy. Usually, poor metabolic health shows up as carrying extra weight and being sluggish, not feeling very good. Your energy center. And then hormone health, we all kind of know what that means. Women, of course, have a variety of hormones, and we'll talk about that. And they play an integral role in how we feel, how long we live, and also in our risk of disease. So really metabolic and hormone health, the way we use energy, determines our daily vitality, our mood, energy, our mental sharpness, protects us from disease like inflammation, diabetes, heart disease, all those things that we saw in the ER over and over again, always getting worse. You go 10, 20 years back, and if you address metabolic health, those things can actually get better. You can prevent that dementia, you can prevent heart attacks. And both metabolic and hormone health are critical to longevity. So, we don't just want to live a long time. We want to live a long time and feel great while we do it. Modern medicine has accomplished great things to buy women in particular an extra 20, 30 years of life. So, how do we make sure we get that and also feel awesome while we do it? Because, I think we often think about, gosh, I hope I don't end up like that, or I hope that doesn't happen to me. But what I want to leave you with today is that a lot of that is in your control, and you can train for whatever age you're at now. You can train for your 40s, your 50s, your 60s, your 70s, your 80s, your 90s. You have a lot of control about what that'll look like, and we will go through some of that now. So we'll start a little bit talking a little bit about metabolic health. So some of you may be familiar with Peter Attia. He's a doctor who works in the field of longevity who talked about the four horsemen of disease. So 80% of non-smokers over 50 die from four things in the US right now. It's either heart disease, cancer, Alzheimer's, or neurodegenerative disease. Something's going wrong with your brain. or accidents. Accidents are accidents, and but the other three are all integrally related to metabolic health. So, really addressing metabolic health early in life can help prevent a lot of these things and improve our quality of life and how long we're living. Um, so again, metabolic health is linked to a ton of stuff. This is just another list of everything that it can influence. So I want to go back in time just a little bit and talk about where we are right now and um, why a lot of people are dealing with weight issues, a lot more than they used to. And, clearly we did not suddenly become people who have no willpower and start, living these wild lives. Something changed between 1997 and 2021 where, before this time, most people were able to maintain a healthy weight. And all of a sudden, now a very large proportion of our population cannot. Um, so, as this happened, we as a medical community, doctors, I think we've done a huge disservice to women in the sense that, that something happened throughout the United States to a lot of people. And when you come in to see your doctor, a lot of them will tell you, eat less, move more. If only it were that simple, right? Then we wouldn't see that map if that was easy enough. And to some extent, the medical community kind of shifted the blame and said, you need to get up, you need to move more, you need to eat less, get some control over yourself. But there was a lot of things happening behind the scenes that got us to where we are now, and we'll talk a little bit about how to undo some of those things. So, um, I'm sure some of us remember the food pyramid that those of us in our 40s and 50s learned about in elementary school, the where we were told to have 6 to 11 servings of bread, cereal, rice, and pasta. Your main source of food should be coming from carbohydrates, and then you should have some fruits and vegetables, some dairy, and then the deathly macronutrient was fat during this time period. And this was because what actually happened was heart disease was the leading cause of death in the U.S. in the 1920s, but it actually started going down. The rates of heart disease were going down quite a bit. The people studying it decided that cholesterol due to high fat intake was the reason why people were getting heart disease. So this food pyramid was created partially also because of the calorie theory. So I'm sure that most of you are familiar with calories. Calories are a measure of energy, and we know that if we eat more calories than we could burn, we will gain weight. So carbs have 4 calories per gram. Protein has 4 calories per gram, but fats have 9 calories per gram. So because of that, there was this big assumption that fat makes you fat because it has way too many calories, obviously, simple math, thermodynamics. So what happened in this time period when we started to strip fat out of everything and we started replacing it with high fructose corn syrup, a lot of artificial processed foods, convenience foods, trans fats, seed oils, the heart disease rates and the obesity rates tripled, and we got a lot sicker. So I'm going to spend the next little while talking about weight and why, that's a little bit of a historical perspective, why we're in this state now where a lot of people find weight management to be a problem, where it's not easy to maintain a healthy weight, not like our great grandparents did. And and for a long time, we've thought about this just as calories, especially in the 90s. You eat too many calories, you gain weight. But it's a little more nuanced, and there's a number of reasons why we gain weight and why it is hard to get rid of it. So um, we'll go through all of these briefly. Um, so calories. Is a calorie a calorie? For a long time, this was what we were taught. If you count your calories and you burn more than you then you eat, you will lose weight. And to some degree, that is correct, but we'll talk about all the other reasons why this is not the best strategy for maintaining a healthy weight and why it's failed so many of us um, and why strictly calorie counting or relying um, on tracking calories to maintain a healthy weight can actually damage your metabolism. And what you want to do is eat, move, have a lifestyle that really heals our metabolism, that allows us to eat food that are whole, natural, that taste good, and that we can use as energy, that we can transform in our body as energy rather than store it as fat. So hormone balance is something that we will talk about a bit here. So, when we think about hormones, especially as women, most of us are thinking about sex hormones. So, estrogen, progesterone, testosterone. Women have testosterone as well. But this is the pyramid of hormones that women and men have in our bodies. And um, they all need to be balanced for the others to work correctly. So the most important hormone that's related to metabolic health is insulin. And we want to make sure that our insulin is balanced. Too much insulin tells your body to store fat and makes you metabolically unhealthy. That is an oversimplified explanation of metabolic health, but it is a crucial hormone that we often don't think about. And then cortisol and adrenal health. So I'm sure we've all heard about cortisol, the stress hormone, and it's complicated to some degree, but we experience a level of stress that our ancestors didn't experience. So in a lot of ways, our lives are actually easier. We have a lot of modern conveniences. We don't have to worry about food. But the strain on our attention is really unprecedented. So the constant notifications, being available by phone, by whatever, by text constantly, um, that has introduced a state of stress and nervous system dysregulation that can really affect our hormone and metabolic health. Um, Thyroid is really important as well, and because of chemicals in our environment, thyroid disease has really skyrocketed as well. So we'll talk about these things just a little bit more. So I promise I'm not going to give a long science lesson. This is the only slide of cells. But insulin is that tricky hormone that really kind of governs your metabolic health. So what it does is it opens the door to a cell to let sugar in. Glucose is another word for sugar or blood sugar. So all the food that you eat is most of it is turned into glucose, which is used by the cell to make energy. And insulin has to open the door, has to open the little blue channel to let that sugar in. And if you are somebody who has struggled with metabolic health, if you've eaten a lot of processed foods, the body becomes resistant to insulin. And then it starts to produce more and sort of overwhelm your body. Tons of insulin comes out, and insulin tells your body to store fat. So it's like an evil cycle. If you're resistant to insulin, you make more insulin, and your body is storing more fat, and you're kind of stuck in this cycle. So what you want is for these cells to be very insulin sensitive. If you are working with a doctor and looking at your blood test, a fasting insulin level, which is not something that most doctors test, but it's a very easy thing to test, will tell you your level of insulin sensitivity. And if you are someone who's dealing with metabolic health problems or weight issues because you're insulin resistant. So eating foods that have a low glycemic index. So a lot of whole foods, trying to prioritize protein and vegetables will increase your insulin sensitivity. Um, both both of these macronutrients just make that channel a little bit more sensitive and allow your body to be more responsive to less insulin, so you're not storing as much fat. And also resistance training. We'll probably talk about resistance training a few times tonight because it's kind of magic for women. We also wrongly for a long time gave women this message that we need to be doing cardio. You need to be burn calories all the time. Resistance training doesn't burn as much calories, but building healthy muscle really improves your insulin sensitivity. So you need less of that insulin and you have less signals in your body um, telling you to store fat. And then talking about cortisol, stress, adrenal health. This is something that I also test in some of my ladies in my practice. Um, so your cortisol um, goes up and down throughout the day, like you can see on this slide. So for a normal, healthy person, you should have a rise in cortisol when you wake up, and that gives you energy. That gives you that get up and go. And then as you go through your day, it should slowly go down until at night it gets very low so that you can stay asleep and then go back up. So, adrenal dysfunction is really another way of talking about burnout. And there's a lot of people experiencing burnout, and it can feel like you're constantly tired. Your brain is foggy, you're irritable, you're craving sugar, your mood kind of sucks all the time and you're doing all the right things, but you're not losing weight. So that can happen because your cortisol is too high. But what I see more often is by the time women come to me, they've had many years of whether it's work or family life where um, they've had to be sort of hypervigilant or they're working really hard, they're working long hours. And the adrenal glands that produce cortisol, they kind of go into hiding and they're like, well, if you're telling me it's an emergency all the time, I'm just not going to put this out. So a lot of times we just never get that nice cortisol spike in the morning to wake us up. You never feel quite energized, but often what happens is that at night for this goes up and women get this feeling of being wired but tired. Your body's tired, you're drained, you want to go to bed, but there's something sort of still kind of wired about in your brain, and it's very hard to fall asleep. So sometimes when there's sleep disturbances and that kind of low energy throughout the day, this is kind of a physical manifestation of burnout. Um, and, to support your adrenal glands, um, the good thing is that for most of these, the steps to get to a better place are very similar. So again, really prioritizing whole foods. We really, um, you know, during that time period that I showed you between 1987 and 2005, there was this industrialization of our food where convenience was really prioritized and fast food was heavily marketed and Whole Foods became more expensive and less accessible. Um, and we really it made us sick in a lot of ways. So your body needs certain nutrients to start producing a normal amount of cortisol again. So whole foods, fruits, vegetables, lean proteins, healthy fats, water. Sleep is important too. Nervous system regulation. So, um, like we talked about before, your nervous system can be on high alert all the time. You're always ready to respond. And making sure that you're doing something in your life that's calming, whether for you that's yoga or meditation or a mild workout or a coloring book or reading, or talking to somebody that feels calming. Having that be a part of your routine where you're counteracting the stressors on your nervous system that happen every day just from living life. And then there are supplements that can be um, quite helpful. B vitamins and vitamin C. Magnesium is wonderful for helping regulate your nervous system and your cortisol. There's a class of supplements called adaptogens, and those basically help your cortisol either come up or go down. So they help your body have a more adaptive response to stress. Rhodiola is one of those. And then for people who are in a real kind of burnout state, I will have them start taking a porcine adrenal gland. That means it comes from pigs. And we actually have a supplement that gives you all the nutrients to basically wake up your adrenals and tell them it's safe. We can start producing a normal amount of cortisol again, and we can get the energy up a little bit. And of course, easier said than done, rest and recovery and limiting caffeine. Um, and then the thyroid, all the symptoms of multiple hormone problems are very similar. Weight gain, depression, brain fog, fatigue. When your thyroid's out of whack, you may have muscle cramps too. You may feel really intolerant to cold, where you can't stand it. When people are other people are warm, but you feel like it's constantly cold. Dry skin, sometimes constipation. Those are signs of low thyroid. And this has also been an epidemic, and um, the reasons are complex. Most of the time when a woman develops low thyroid, it's because of autoimmune attacks on the thyroid, which means that your body attack your thyroid gland thinking it's something else. And the reason we think that this has really gone up is again because of a lot of chemicals that we've never been exposed to as humans, that are in our food supply, in our water, in our environment now, um, that have triggered this um, autoimmunity that a lot of women experience. Stress can also be a part of this. So um, we can take a second now and I can answer any questions before we move forward if there's, let me see if I can look at the chat. Give me one
Yeah,
sec.
Dr. Geyer, there was one in the chat. Is there such a thing as drinking too much water?
Yes, but it's hard to do. So your body has a pretty good natural um, set point for water. So we see water toxicity in the ER, but most of the time it's people who are mentally impaired, either like cognitively impaired with dementia um, or are psychotic or on drugs or something like that. So it's hard to do it if you're in a normal state of mind. But I would say 64 ounces is usually your sweet spot. If you want to drink more than that, you can. Um, but going much above 80, it probably won't do anything for you except for keep you in the bathroom for a lot of your day.
Is ashwagandha an adaptogen or something else?
It is an adaptogen. Yeah. Um, so sorry, I'm trying to get back these two. Yeah, ashwagandha is an adaptogen. It's very good for kind of leveling out stress levels. It's more of a calming adaptogen. Something like rhodiola can be a little more stimulating. So yeah, I think that's a good adaptogen as well.
If one has low thyroid, how often do you think they should get their medication checked to make sure it's at the right level?
Yeah, that's a great question. And it really depends. So some women have low thyroid and they have these symptoms and they get their medications, their numbers go back to normal, and they feel great. Whereas other women, they get their numbers to normal, but they still don't feel right. And there are thyroid hormones that most conventional doctors don't check, again, because most of our modern medicine is centered upon preventing, death and disability. So like we're just not all that sophisticated in making sure that people feel really good. So um, there is a more extensive thyroid panel that we can look at. Um, and, when I'm checking it, I check it until somebody both has normal numbers and feels better. And once you're normal and you're at a set dose, some people just get it checked once a year or every 6 months. But I think until you're normal, it needs to be checked pretty frequently. 6 weeks, 3 months. You make small changes until you both have normal numbers and you feel good. And there are different, Synthroid is what most doctors use. It's the least expensive. Insurance covers it, but there are different strategies, and um, thyroid health can be pretty nuanced.
How does melatonin affect your circadian rhythm?
Yeah, that's a great question. So there's a lot of research on melatonin now, and um, it actually has a lot of positive effects. Taking very large doses, there's some research now that's pointing towards potential risks of dementia, but that's like 15 milligrams plus. But we're seeing a lot of positive studies about melatonin when it comes to inflammation, and especially for women in perimenopause. So taking melatonin, if you take it at the same time every night and it's part of a good sleep hygiene routine and you're taking a fairly low dose, it will not negatively affect your circadian rhythm.
And then last one for now, what would be an optimal daily amount of unstressed or unplugged time?
I love that question. And I think it does differ. I think it differs for each person. Um, I would say, it depends where your lifestyle is. There are probably women here who have three children and a demanding career, and getting 15 minutes to yourself may feel like a luxury. So taking 15 minutes will, maybe all you can do. But ideally, it's about, I think, checking in with yourself. And um, most of the time we can tell when you're kind of wired and a little bit stressed and overwhelmed, and there's a lot coming in. And um, I think taking that, making sure that you make that a priority, and you take that time for yourself. And unfortunately, screens don't do that. I know we all love to relax in front of the TV, but that's just, it doesn't do that physiologically. So, um, and it may be a different activity for different people, but um, I think making sure to treat ourselves well, and take that warm bath, or read that book, or demand some alone time is important.
There were a couple more that popped up. Do you want to continue or do you want to take a couple more questions?
Let's take a few more questions.
I heard intermittent fasting helps with insulin resistance. Is that something that could be helpful?
Yes. And again, it's one of those things that also depends um, where you are in your life and in your reproductive cycle. It can be very helpful, but not when it's done to an extreme. So, especially if you're in the perimenopausal transition. So, and I'm gonna talk a little bit about that. Uh, Perimenopause can start at age 35. It can start much later. It really varies, but our hormones start to go wild, and um, we need a lot of nutritional support during that time. So, what I find women often do is they find it's harder to maintain their weight. So they start eating less and less, exercising more and more, and these symptoms get a lot worse. So I think intermittent fasting, if done thoughtfully, and where you're getting enough nutrition and nutrients, can be very helpful. I think at the minimum, all women would probably benefit from not eating after dark during our current light situation. I know that it gets dark at like 4 p.m. in the winter, so that may not be feasible. So it may be like 7 p.m. at that time. But I think that would help everyone. And then just making sure that if you're intermittent fasting, it's truly intermittent, because there are some women who are very productive and can go to like 4-hour eating windows every day, and it's been like that for 3 months, and that's where you're no longer probably helping yourself. So um, doing a fast, doing a quarterly prolonged fast, or once a week or a few times a month, I think could be really helpful. But just making sure you're getting adequate nutrition.
And then, should we worry about protein powder interrupting our hormonal balance as a highly processed food, or do its benefits outweigh its drawbacks?
So, yeah, another great question. And there are protein powders that are less processed and ones that are more processed. And I think you just need to look at the ingredients. There are some beef protein isolate. Those protein powders tend to be a little less processed, where um, you're getting less, if you have it, look for those that have a list of ingredients that where you can understand most of them. So, um, and I think the worst ones are probably marketed to men. The superpower become Superman, which will have a whole bunch of junk in there. But there are some more organic. So I think the ones that I found that have been most pure and whole are pea protein, PEA, like the vegetable pea, or beef isolate.
Last one for this section. If your doctor takes a eat less, exercise more approach, who do you push to see to determine if there are metabolic factors at play?
Um, so that's another really good question. And um, most of us just don't learn this in medical school. And not to go into like a conspiracy or anything, but most of what we learn is determined by pharma, where the model is pill equals disease. So if there's not a medication to treat it, we're not going to learn about it. So it's there's a ton of well-meaning doctors out there, but we kind of have to go out and learn on our own to really understand this. So I think finding somebody who understands some level of functional or integrative medicine and metabolic health. Unfortunately, it's less common than it should be. I'm I hope that we will move more in the direction of understanding and paying attention to these things and preventing these diseases before we ever need those pills to treat them. But but I don't think that there's an easy kind of answer to that. All right, so we will keep going. Um, So we're going through these causes of what makes us overweight. So we talked a little bit about calories, we talked about hormone balance, and then we come to inflammation. So inflammation is when your immune system is overactive. So your immune system is kind of on fire in your body, even though there's not an infection. It's looking for threats, but there really aren't any, and this will cause more insulin resistance. So again, those cells are seeing insulin, but they don't want to respond to it. So your body makes more insulin, store more fat. Inflammation itself will dysregulate your appetite and make you more hungry, cravings, and also you feel kind of sluggish and crummy when your body's very inflamed. So and then it's again one of these things that that's sort of circular in the sense that if you have normal fat tissue, it makes chemicals that are anti-inflammatory. But once you are overweight or obese, the fat tissue itself is going to release these chemicals that increase your inflammation. And the biggest drivers of inflammation, I would say the number one in our diet is sugar, um, and seed oils, high fructose corn syrup, sugar, and things like high fructose corn syrup are extremely inflammatory and cause a big inflammatory response in our bodies. And then the next thing are mostly chemicals like pesticides and other, right now there's a lot of people trying to get rid of, there's a number of food ingredients that are banned in Europe that are still allowed in our food here in the US. So some emulsifiers, there's basically the food labels where there's a lot of things that we don't understand that we couldn't find in our kitchen. They can be highly inflammatory and lead to more inflammation in our body. And then one of the last factors of why we become overweight is problems with our gut microbiome. So our guts, our colon in particular, has more of these little microorganisms, of these bugs, bacteria. We actually have more bacteria living in our colon than cells in our whole body. So we have this whole universe of microbes, of bacteria living inside of us. And we're just starting to understand what those do. And it's a very exciting area of research, and they really affect how we're going to process nutrients, how we're going to regulate blood sugar, and how we're going to store fat versus burn it for energy. Um, they also control our level of inflammation and our hormone signaling to affect how quick our metabolism is able to burn foods, and they can regulate our appetite and just feelings of fullness. Um, so if you have a disrupted microbiome, you'll be more insulin resistant, and um, it will be hard to maintain energy. And I could give a whole hour on just gut health and gut microbiome, but the big take home points here are antibiotics mess you up. Um, Fake foods will mess you up. And the things that feed your microbiome the most is fiber and fiber that comes from vegetables and beans. So and the other category of foods is fermented foods. So like sauerkraut, kimchi, those have been found to be really beneficial to our gut microbiome. So what we want is a diverse microbiome, which means a lot of different healthy bacterial species in the microbiome, and and they need the fiber from food in order to thrive and to live. And a lot of those ingredients that we are talking about affect our gut microbiome too. Things like Diet Coke, Coke Zero, there's a bunch of stuff in there that just is killing our gut microbiome. And it may not be giving you extra calories, but all these signals that these little bugs are sending to your brain and to other organs are disrupted when they see chemicals that are not real food. So the last two things for metabolic health are sleep and stress. So sleep is really important. It um, regulates the key metabolic hormones. Insulin, we talked about. Ghrelin and leptin are two other ones, and they also determine how much fat you store and how hungry you are. So, um, when you're not sleeping well, if you're not sleeping enough, if you don't have deep sleep, you will have more hunger hormones, and you'll have less of those hormones that make you feel full. You'll be more insulin resistant, and um, and if you're consistently getting poor sleep, it will increase the amount of visceral fat storage you have. So there's two types of fat. Visceral fat is the fat around your organs. And then subcutaneous fat is the fat that's under your skin. So if you can grab it, if it's in like a fold, that's not as bad. We don't like the way it looks, but the hard fat. So if you think of like a man with a beer belly where he's a big guy, but he almost looks like a pregnant woman. It's all kind of hard. You can't grab a roll. That's visceral fat, and that is much more dangerous for your overall health. So I will talk about some strategies for sleep. I want to make sure I have time for that. Um, but if you need to take an herbal supplement, something to help you go to sleep, then it's better to do that and to get that consistent sleep because it's so important on so many levels. And then we talked a little bit about stress. So um, again, stress doesn't always feel like stress, but that always being on is a physiological stress. So it's a stressor to your body and your metabolism. And when you have chronically elevated cortisol, you again store more fat, more insulin resistant, triggers more food cravings, and disrupt your thyroid function and can just lower your metabolism overall. Um, And then mindset. I think mindset is really important for weight and um, metabolic health. I think, you know, we've lived through this period of time where weight has become a problem for so many people, and um, wrongly so. I think a lot of people feel personally like especially women, there's a lot of shame associated with it. And as women, we were kind of told that we needed to be small, and our value was tied to that. So just touching briefly on this growth mindset versus fixed mindset. A lot of times we'll try a whole bunch of different things and nothing works. And you can get stuck in this mindset of, I'm always going to be like this. This is never going to change versus I'm going to figure this out. This is just a temporary setback and there are solutions. And um, knowing that if you're battling something, you're not alone, and there's a way. There's always a way out. And knowing that you yourself can change. And even if habits have been there for a long, long time, they may not be your fault. There may be hormonal derangements going on in your body that make it really hard to change. Um, so before, for the rest of the time that we have, um, we actually don't have that much time left. So I'm actually going to go through the women's hormones, and and then we'll do another set of questions. So we talked about all these hormones at the base of the triangle of how to take care of them, and then we'll talk a little bit about sex hormones. So this is an overly simplified um, view of what happens to a woman's sex hormones. So we're children, then we go through puberty, then there's this fertile period, and then there's menopause. Of course, it is a lot more complicated, and we will talk briefly about that. Um, and first, I just want to touch on our reproductive years. So, again, this is something that most doctors don't test to some extent unless you're having trouble getting pregnant. But the most common hormone disruptions during our reproductive years when we're still cycling are PCOS, polycystic ovary syndrome. It has become far more common. It's very much tied to insulin resistance, where you're getting irregular periods, weight gain. There can be some infertility, excess body hair. And also, a lot of women now experience something called estrogen dominance. So our major sex hormones are estrogen and progesterone, and they should be balanced with each other. But due to a number of reasons, for a lot of women, we have more estrogen than we have of progesterone. And then we get these heavy, painful periods, mood swings, bloating, weight fluctuations, and it can feel very fiery and unhappy. And we talked a little bit about thyroid dysfunction and chronic stress. So those are kind of the things that women face during the reproductive years. Um, and like we talked about, perimenopause is the period of time between your prime reproductive years and menopause. And it's a messy time period of what's going on with your hormones. And for some women, it happens quickly. You kind of transition into menopause and it's painless. But for a lot of women, it's a long period of time of ups and downs and not feeling like yourself. A lot of women describe it as feeling like they're going crazy. They don't feel like they did for most of their lives, or the things that they've done to maintain themselves, their weight, are just not working anymore. And it's really this disorganized hormone period where estrogen's going up, down, all over the place, and progesterone is sort of steadily decreasing. Um, so again, you're not going crazy. It's menopause. There's a lot more symptoms than we think about. It can go on for quite a number of years where things don't feel quite right. So again, the two big hormones that play a role in perimenopause are estrogen and progesterone. Um, Progesterone drops kind of quickly and earlier than estrogen. So that's kind of the first thing that's happening in perimenopause. And low progesterone. Progesterone is like nature's Xanax. So, what a lot of women start feeling is more anxiety, like less resilience to stress. So basically, it's like that nails on a chalkboard feeling where things that used to not bother you so much are all of a sudden like a really big deal in your head. Um, we can feel brain fog. There's a lot of changes in the gut. The microbiome really changes as our hormones change. And uh, inflammation really goes up. So progesterone is anti-inflammatory. And as we start losing progesterone in that perimenopause period, um, the rate of autoimmunity really goes up. So a lot of women are diagnosed with rheumatoid arthritis, with autoimmune conditions as that progesterone starts falling. So progesterone, nature's Xanax, inflammation. And it can happen a long time before you actually reach menopause. And then estrogen is kind of like this lady here. It's like more of our fiery feel-good hormone. But if we get too much of it, it's going to cause those heavy periods, painful periods, mood swings, and go too far in the wrong direction. But if it's low, then you also start feeling crummy. Um, so fluctuating estrogen. So again, during that perimenopause period, your estrogen levels are going up and down, up and down. You can have some up days, some down days, and that's where the hot flashes come from. The periods change, night sweats, mood swings, vaginal health changes. You start getting less libido, weight gain, skin changes. Those are all related to your estrogen levels. And then testosterone. We don't think about testosterone as much in women, but it's also really quite important. And it's something that I often find is very low in my ladies who are coming in with hormone issues. Um, and those women are very tired. And testosterone is kind of the hormone that makes effort feel good. So we often think about it as with exercise and sex, but it's the hormone for drive. So um, a lot of times what women will tell me is that like I just don't feel like it. I don't have that get up and out of bed and go. The things that used to kind of excite me and push me forward are just not there. So energy, muscle, cognitive function, and libido are all related to women's testosterone levels. So um, the rest of the time, I just want to talk about what we can do. So I initially wrote this as a survival guide, but I changed it to a thrive guide because I don't want you guys just to survive. I want you to, be where you really want to be during whatever stage of life you're at. So um, before we go into all the details, I want to really encourage you to make yourself a priority. I think women in particular tend to put ourselves last, and everything else kind of goes ahead of your well-being. And move towards your goals with determination and grace, which means keep moving forward, but give yourself grace. You're going to mess up. You're not always going to be perfect. It's not easy to always take care of yourself, and that's okay. And then lastly, be your own experiment, N of one experiment. So um, not everything works for everybody. So listen to your own body. You're the expert in your body, and you'll need to figure out what works for you and make sure that you're doing that. So we talked a little bit about food already, where um, ideally, for both metabolic and hormone health, you'll want about 25 to 30 grams of protein at each meal. So that's kind of a palm-sized amount. Animal protein tends to do a little better, but you can use non-animal protein too. Greek yogurt is great, beans, even cottage cheese. And then you want colorful vegetables, making sure that you're getting at least 2 meals with a lot of vegetables. So that's to feed your gut microbiome, to get all those micronutrients, to make all your other hormones work the way they should. Healthy fats are really important for women, especially in the perimenopause period. Don't be afraid of things like olive oil, nuts. We need that. We need that in order to make hormones and to keep our bodies healthy. And we, of course, want to limit the refined processed carbs and focus more on fiber-rich options. We had some questions about fasting. You want to, I think, strategic timing, eating within a 8 to 10 hour window. So between your first and last meal of the day, keep that between 8 and 10 hours. That tends to work really well for women. And eating larger meals earlier in the day. And the hardest one is leaving 2 to 3 hours between dinner and bedtime. Late night snacking just kills all of this. So we want to stop eating after our last meal for both metabolic and hormone health. Um, so some little tips and tricks to keep yourself insulin sensitive. If you eat your protein first before carbs, protein and vegetables before carbs, but protein first, it will actually allow your body to be more insulin sensitive. So you won't have as much glucose spikes. You'll have less of that insulin, less fat storage. So if you have a plate and you want to eat a little bit of macaroni and cheese, eat your chicken first, and then you can go on to the stuff that's a little less healthy. Also, having a tablespoon of apple cider vinegar can really improve your insulin sensitivity, and walking within 60 minutes of a large meal, that's also pretty magical for a lot of women and can so you don't have to necessarily make drastic changes to what you eat, but just little strategies to change the way your body is responding to things. Um, Movement, you want to do strength training as well as cardio. Walking is great. Trying to get your steps in every day is going to be super helpful for cortisol, inflammation, all the things. Recovery, you want to make sure that you're balancing high intensity days with recovery days. Recovery is very important. Again, I'm sure there's some type A ladies in here who go hard every single day. And if you don't give your body time to recover, you're probably not getting everything that you want out of exercise. And the first, so when you start your period, you start the follicular phase of your cycle. And until you ovulate, that's probably the time of your cycle where you have the most energy and you can train most intensely. And then during that second half of your cycle, you want to focus more on recovery. We talked a little bit about sleep. Sleep is important. Um, Having a sleep routine where you're waking up and going to sleep at a consistent time, that your bedroom is dark, that you're not using screens within an hour before bed, that you're keeping your room a little bit cool. And yoga nidra is a type of kind of guided meditation. There's a bunch of it on YouTube, but it's not yoga. You lay with your eyes closed, and it guides you to kind of pay attention to different parts of your body. But it seems to calm the nervous system. It's also called non-sleep deep rest, but it's really powerful for getting you to sleep when you do have a little bit of that wired and tired feeling. Um, and then my favorite supplements for sleep are magnesium, glycine, melatonin. I think those are really good, and there are some supplements that combine them that can be very helpful naturally, just taking the edge off and getting you to sleep. Um, So we talked a little bit about stress and how it hijacks the hormones. In the interest of time, I'm just gonna kind of go through this quickly. We talked a little bit about strategies to counteract the stress that's happening to your body, whether it feels like stress or whether it's just being on for prolonged periods of time. Getting out in the sun and having some sun exposure can really help your cortisol rhythm. Doing some breath work, making sure you get out in nature, getting away from screens, and connecting with other people and making sure to practice gratitude can be really helpful for just maintaining how stress affects your body. And um, we have very little time left. So there are a number of supplements that I think can be really helpful for women for balancing both your hormone and metabolic health. Um, Magnesium, again, I think is great for most people. Most women have some deficiency of vitamin D3, and omega 3s, which are sold as fish oil, can be really helpful for inflammation. Those are ones that I think would be helpful for most people. And then there are ways of actually testing and looking at your labs and making sure that you're taking supplements that will actually help you. So if you have the ability, in my practice, I usually we do tests, we do blood work, and we try to not throw a million supplements at you, but make recommendations of things that will actually help. Um, so bioidentical hormones are the last thing that I just want to spend a couple minutes on is prescription options. Bioidentical hormones can help smooth out that perimenopause, menopause period. And there was a large scare about hormones a while back, mostly because we were using synthetic hormones made out of horse urine, and surprise, surprise, those weren't great for women. They caused cancer and a lot of other problems. We now have bioidentical hormones, which are exactly the same as your body makes. And if used strategically, they can be very helpful and actually improve your longevity and overall health. And then I'm sure that there are some questions about GLP-1s because they have really changed the face of weight management in the recent years. So the GLP-1 agonists, they're Ozempic, Wegovy, Mounjaro, Zepbound, Saxenda. They're injectable medications that mimic a natural hormone that's produced in the gut called GLP-1. And they work in a number of different ways, and I think we still don't fully understand all the ways that GLP-1s work. Um, they definitely regulate the appetite. They slow the gastric emptying, so you feel full longer. They improve your insulin sensitivity, so they do improve your metabolic health and reduce the glucose sugar production by your liver. Um, Most people from the data from the pharmaceutical companies lose 15 to 20% of their body weight in a year to a year and a half. I do use them with some people in my practice, and we combine them with intensive lifestyle changes, and generally we have people lose about 25 to 30 pounds of fat in that time period, where we focus on maintaining muscle, maintaining or gaining muscle, and really just losing fat. But there's a lot of promising things about these medications. They've improved heart outcomes, decrease inflammation, can protect the liver and the kidneys. Um, and the risks, there are GI risks. So sometimes people get nauseous, they have vomiting, constipation. Rarely we have more serious risks like pancreatitis or gallstones. And then there are some things we don't quite know about, which is we're still studying thyroid C cell tumors. None of the long studies have found any issues with tumors on people in this drug, but there were some animal studies that were concerning. Um, and then diabetic eye disease. So that's a different category of patients we have to be extra careful with. Um, so who benefits most? I've found that women with insulin resistance, prediabetes, diabetes, hormone imbalances, PCOS, people who have real appetite dysregulation for any reason, and those of us who have a history of crash dieting, weight cycling, that can be really hard on the body. And um, I find that if we use them for even a short time, sometimes it can help reset the metabolism a little bit. Of course, you cannot take it if you're pregnant or breastfeeding, and then there's some cancer history that is contraindicated. Um, the main thing is that this is not magic. It's not a quick fix. I think if you just take a GLP-1 and change nothing else, the moment you stop taking it, everything will go back to the way it was before. But I think that there's a way to use it in the lowest effective dose alongside strategic diet, exercise, lifestyle changes that that can be really helpful. So there's a lot of debate whether this needs to be used long term versus short term. I think it can be used short term. I have used it short term with a lot of my patients with great success, and um, it's a tool like anything else. It's a tool, and we have to really look at fixing what's going on under the hood. But sometimes we can use the tools like medications at our disposal to get to our goals a little bit faster. So that's it. I'm sorry that I ran a little bit over time, but we can answer any other questions.
Yeah, there were a few that popped up. Can things like PTSD increase your cortisol levels?
Absolutely. Yes. Um and it can go both ways. You know, PTSD can um cause some level of burnout where your cortisol is high for a period of time and then it really crashes. But yes, PTSD and other mental health disorders can definitely affect your cortisol.
Okay. The topics that we're talking about are is a nutritionist familiar with them? She's heard a lot about nutritionists, trying to evaluate if she should see one or not.
I think that depends. Again, I think there are probably some great nutritionists who do have a good understanding of about this. Um, I'm not sure if everyone does. So I think if you're working with someone, I think you can always interview them before entering a relationship and just say, you know, I want to talk to you and get your take on a few things. You can see what their kind of model is and try to do a little recon before you commit.
Would you recommend, who would you recommend for these topics? Like a functional doctor, endocrinologist,
I mean,
OBGYN?
I would recommend myself. If you're in the DMV, we would love for you to come see me. But yeah, if you're in this area, we have offices in Vienna and Berk, and we do a lot of telemedicine too, so we can do everything remotely. Um, but there are a lot of wonderful nutritionists. I work with a number of nutrition focused health coaches that where we do a lot of this lifestyle counseling along with the medical care. But I think you can always search out nutritionists and other doctors who have a more integrative kind of approach.
How much fat per day is too much fat?
So again, I think that's a hard question to answer. It depends where you are, and if you're trying to lose weight, you have to limit your fat to some extent, you know, because it is very calorie rich, like we talked about in the beginning. So if your goal is to lose weight, um, you probably can't have unrestricted fats. But if you're at a healthy weight, I think including things like olive oil or full fat dairy, olives, avocado, healthy sources of fat. So when it comes to whole foods, one of the other wonderful things about them is that they're hard to overeat. So like most of the time, you're not going to sit down and eat six avocados in a row. Or eat six apples, you know. Whereas if that amount of carbs were in a bag of chips, you could easily just keep going and going and going because those hunger chemicals are stimulated. So if you're trying to lose weight, you have to limit it, but trying to stick to whole food sources of fat um, is the best way to go.
Awesome. Dr. Guy, thank you so much for doing this for us. We appreciate it so much. I think
Yeah.
we briefly talked about maybe doing a part two if we had interest in that. So if there is interest, please let us know. But thank you so much for your time.
Yeah, of course. This was great. Thank you.
Mary Beth, was there a form that you wanted to? There you go. Oh, it's in the link in the chat. Yeah, if you're interested in a part two, let us know in that form and then let us know what you thought. Thank you.
Yeah,
Thanks for
and
being
if there's any specific topic for a part two, because each one of these
here.
could be a whole hour.
Yeah, I think we went over so much today. So
Yeah.
it was like information overload, but it was amazing. Thank you.
Yes, of course.